Hello, this is Angie from Daisy Family Health. I hope all is well with you. Today I wanted to talk to you about direct primary care coupled with a health share. So, direct primary care is a membership-based healthcare clinic, which what we are, and a person pays a monthly cost, usually very reasonable. Our rate is from $55 to $65 per month. If you are an independent college student, it's only $25 per month. If you are adding on a child, it's an additional $10 per month. And what that includes is all your office visits throughout the year. I like to do a comprehensive physical on all new members to kind of devise a plan and see how we're going to take care of you. We can care for you if you have chronic conditions such as diabetes, high blood pressure, thyroid disease, and we can also try to keep you well. I really love to focus on prevention. And so, even if you do not have any diseases, conditions, however you would like to call it, I still want you to be a member because I like to talk to you about preventing those diseases from happening in the first place, right? And then I especially want to talk to you about a health share right now because it's open enrollment until December 15th. And so, what we are encouraging our members to do is to pick a health share. We have teamed up with Zion Healthshare, and what they do is they offer a discount to direct primary care members. So it depends on your age and it depends on the initial unshareable amount that you pick. So, what does that mean? Initial unshareable amount means exactly what it says. So, say for instance, you get into a accident and you end up needing knee surgery. Your initial unshareable amount would be your out of pocket costs. So they have a $1,000, a $2,500, and a $5,000 plan. If your surgery ends up being $80,000 and you pick the $1,000 plan, that cost is what you're responsible for out of that $80,000. And then it depends on the rate. So, of course, the $1,000 plan is the most expensive, but because you are a member of Daisy, it ends up being $159 per month. And then if you pick the $2,500 plan, sorry, I'm a cheat. That ends up being, I got my glasses on and I still, okay, I'm looking too high, $122 per month. And if you pick the $5,000 plan, that ends up being $108 per month. Of course, it depends on your history. If you see different specialists and things like that, you may want to pick the $1,000 plan if you're a higher risk. Otherwise, you can pick the $2,500, the $5,000. But I want you to have some type of coverage for if you go to the hospital, because direct primary care covers your outpatient, your primary care. And we can take care of a lot of things. That's why I always tell my members to call me or text me before you consider going to the ER emergency room, because many things we can do in office. Say you have been vomiting all day, we can put an IV in you and give you IV fluids. We do not want you to go to the ER or urgent care if you don't have to. There's some instances where you have to. Anyway, sorry, I'm getting off a track here. But that is just an explanation of direct primary care coupled with a health share, and it is an option that you can choose when you are choosing your health insurance or your health care for the year. If you do decide to go with health insurance, we are still here for you because the services that we offer um, is next to none out there. Same day visits, next day visits, sick visits, discounted labs, discounted medication, personal care. Our minimum visits are 30 minutes. And then for new members, it's an hour for the initial visit. And sometimes it takes longer than that. So we're really personable here. And have insurance or not, you still need to choose Daisy Family Health. Have a blessed day.